And we also have a breast cancer action plan, because breast cancer, as you've heard, and by the way, I really get encouraged when I hear stories like Mwende's story, which really give a lot of hope to many of the people, victims, who are affected by this very big problem. So we have an action plan just geared towards breast cancer, running between 2021 and 2025. So maybe just to say that actually cancer is one of the biggest public health problems in Kenya. Actually it ranks very highly. When you combine all the infectious diseases, actually now it comes a close third, because when you do all the infectious diseases, they come top. Then we have the cardiovascular diseases, and then we have cancer. So it is a very big problem, claiming thousands of lives every year. I know that we will I'll give an opportunity for others to put in the statistics, but it is a very, very big problem. We are having very many new cases, very many unacceptably high number of deaths globally, within the Africa region, within Kenya. It is something that we really have to pay a lot of attention to. Now, just so that I can also conclude and give some time to my other panelists, fellow panelists, to say something. What I'd just like to say is that we have now started rolling out a very big policy in the country around, very ambitious, by the way, to try and make sure that we are rolling out universal health coverage. And what we mean by universal health coverage is that each and every Kenyan who, is able to access high quality care, medical care, at an affordable cost. Yeah? And that is a very ambitious plan, because I'm saying this on this World Cancer Day, because the cost of treating cancer is unaffordable to most people. So that becomes one of the specific areas that we are targeting, to say even those who require lots and lots of money to be able to manage cancer then should be able to get treatment. But at the bottom line of this policy, we are saying that we want to prevent a situation where people will require to use a lot of money. So we are putting a lot of emphasis on health promotion and disease prevention, so that we minimize the numbers of people who need treatment, that expensive treatment. We are focusing more on screening, so that we detect cancer early, and then we are able to manage. Because when we get it early, and I know a lot of the panelists here will really expand on that, then even the chances of treatment are increased, as opposed to when we now get it much later, then we find that it becomes more difficult for us to achieve good outcomes in terms of treatment. No. So as a government, we are on the front line to ensure that we actually put this problem under control, so that we reduce the numbers and we have much more effective outcomes in terms of detection and treatment. No. Thank you.
Shukran sana Daktari Sultan Matendechero, ambaye ni naibu mkurugenzi mkuu kutoka Wizara ya Afya.